All right, you all, just because I just can't tolerate the silence. I'm trying so hard, but I just can't. So we're going to go ahead. I just saw Chairman driving around, but I'm sure he'll be here in a couple minutes. So good morning, everyone. There you go.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we've watched were so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Brantley Dunham. Did I say that right this time? Okay. You all remember that name. Thank you so much. You were great. Right this way. Good job. Good job. That's our future, guys. Let's give them another round of applause. Thank you, Zach, and thank you, Brantley. As you all know, events like this would not be possible without our amazing sponsors and support of our community leaders and collaborators, whose generosity allows us to keep events like this going. A special thank you to our presenting sponsor, Hospice of Limestone County. Suzanne Paysinger, would you please join me on stage to receive a token of our appreciation and give remarks? Let's give a round of applause, guys.
Thank you, Pammy and Brantley. Where are you? That was fantastic. I want that recorded to wake me up every morning. That was very, very. I loved it. So, on behalf of Hospice of Limestone County and our independent board, we are so proud to be a presenting sponsor today. We'd like to thank Traci and the hospital administration and the chamber for just seeing the important role that healthcare plays in our community. So we look forward to hearing from the panelists today, and thank you all for coming.
All righty, so our gold sponsors are Athens State University and the Orthopedic Center. Can I please ask all of our sponsors to please stand so they can be recognized? Athens State Orthopedic, thank you. Thank you so much. I would also like to take a moment and recognize a number of guests that we have in attendance today. If you are an elected official or representing an elected official on a local, state, or federal level, would you please stand so we could recognize you? Come on. There we go. Thank you. You all may be seated. Thank you so much for all of your support. We were here yesterday with the groundbreaking, and I just love how our elected officials continue to support us, and we thank you and appreciate you all. As always, we appreciate Athens State University for hosting us today. Dr. Wellberg, would you please join me on stage and give welcome remarks?
Thank you, Pammy, and welcome everyone to Athens State University. We are honored to have you here today, and I know that the conversations that you will have today are some of the most important conversations that we are going to have because healthcare is essential. And as we look and see the growth that's happening in Athens and Limestone County and our surrounding areas, we are going to have incredible needs in the areas of healthcare. So this is so important, and I'm thrilled to have you all here at Athens State University. We are happy to have you here. I hope that you are able to find sufficient parking. I know that is going to be changing. As Pammy mentioned, we had a groundbreaking yesterday for our Carter Hall renovation and addition, and that is going to impact parking somewhat over the next couple of years. But it is something that will be well worth it as we continue to grow and meet the needs of our community, of our growing student body, and of the state. So welcome to Athens State. So glad you all are here. And please have the incredible necessary conversations today and moving forward on the ways that we can continue to serve the state of Alabama. Thank you.
Okay, thank you. Today is about shining a spotlight on both the challenges we face and the remarkable progress being made in our local healthcare sector. Each of these leaders offer a unique perspective on the current state of healthcare, from emergency and surgical services to nursing, leadership, hospital administration, and specialty care. Their insights will help us better understand the challenges, highlight innovation and growth, and explore what lies ahead for healthcare in our area. As we begin, I encourage you to listen and engage. Thank you again for being here. Your presence shows just how important healthcare is to our shared future. At this time, I would like to invite Susan Claiborne, just right here to my left, Director of Marketing at Athens-Limestone Hospital, to introduce our panel and facilitate today's discussion.
Thank you, Pammy, and thank you for hosting this event. First, we'll just go through a couple of introductions and we'll get right into the questions. So on our panel today, we have Traci Collins, President of the Athens-Limestone Hospital, Bret McGill, Director of Emergency Services, Anthony Blackwood, Surgical Services Director, Catherine Brown, Chief Nursing Officer, and Dr. Crystal Walker on behalf of our physician staff at the Heart Center. So we'll start right off with you, Traci. So as president of a 71-bed hospital, what unique challenges and opportunities do community hospitals face compared to larger systems?
Well, first, I would like to thank Pammy and the Chamber, Zach, for having this today and inviting the hospital to tell you a little bit about the things that are going on. And also, I want to recognize the hospital employees that are here. I see members of our board. I see Mr. Payne, a previous CEO of the hospital, foundation board members. So thank you all for all you do. And our employees are truly what make us unique at Athens. And you mentioned what's unique about the challenges and opportunities of a small hospital. I made me some notes, y'all, because if I don't, I get off topic real easy. Everybody knows that. The bed size is the first thing I want to talk about, 71 beds. In October of 23, we were awarded a certificate of need for additional 30 beds. So we're now a 101 bed hospital. Construction hopefully will start. I got more information on that yesterday. The old 2 South will become 25 more beds there, and then the other 5 beds will be other places throughout the hospital. But we're excited because this week we've been holding people in our ER and on our 1-day surgery unit because we're growing faster than we can keep up with. I don't think people really realize how busy we are and how busy we stay. I did some stats from last year I thought everybody would find interesting. We have a 17-bed ER, and last year we saw almost 30,000 people in our ER. We have 21 clinics located strategically throughout the county. We have them in West Limestone, Tanner, Elkmont, Capshaw. We have a clinic in Rogersville, and then we have several clinics here in Athens proper. And with those clinic locations, last year alone, we did over 122,000 visits between the 21 clinics. We currently have we have right at 1,100 employees, over 150 active medical staff. At a lot of our clinics, we also do registrations, and we have on-site lab, and some places they're imaging as well. Over 129,000 registrations that we did last year. Over 782,000 lab procedures were done at our hospital. Over 100,000 imaging studies were done. We did almost 12,000 surgeries. And Anthony's going to expand on that a little bit later, but we have the second busiest surgery department in the Huntsville Hospital Health System. So for our size to be as small as we are extremely busy. We also ran over 14,000 ambulance calls. Our EMS is busy all the time. We also have several stations. I think Bret will touch on that a little bit as well. But being small, we have is actually can be a strength. We can be nimble. We can pick up the phone and call. We don't have to go through a lot of channels to get what we need, and we can stay patient-centered. And I think that's important as far as our community involvement. Some of the specialties that we have that we've never had before that we've brought in the last few years, gastroenterology. We also have pulmonology and critical care physician on staff now. We have Dr. Walker, who's with the Heart Center, and she has welcomed a new partner this summer. And we also have a mental health clinic. So these are very, very important things, and I think that shows the strength and the growth that we have as a hospital. The challenges, people always tell new employees the things that keep me up at night are patient safety. I worry about keeping our patients safe. I worry about our quality. I say worry about it. I'm extremely proud of it. We've won 3 awards for quality at the state level, and working very hard. We have great quality scores with low infection. Customer service, we're a 4-star hospital for our customer service. But financial sustainability is a challenge, low reimbursement. A misconception about reimbursement or the finances of a hospital. I talked to Randy yesterday. We get about 23 cents on the dollar for reimbursement as a whole for insurance payers. But one of our greatest challenges is obviously space, because the community is growing much faster than we could keep up with.
Thank you. Well, obviously, with that growth, we also have to look at our workforce. So, Catherine, this question is for you. How is Athens-Limestone Hospital addressing workforce shortages, especially in nursing and even other critical areas?
Good morning, everyone. Can you hear me? Sorry. Good now? Okay. So one of our number one goals is recruitment from within our community in Limestone County. And one of the programs that we're very excited that we're doing is our ambassador program. And that is where we have selected juniors and seniors from each different high school. And they're selected and they're able to do a year program with us. And that is where they get to shadow and do different community projects with us out in our community. And it's been a great thing to get them exposed to the hospital in different areas. So if they're interested in the hospital at a young age, we're able to help start that recruitment then, which is very important. Another one of the ways that we're trying to recruit nursing is through our nursing apprentice program, which has done wonderful things, and we have received wonderful nurses from this. But we have partnered with Calhoun Community College and most recently UAH. And what it is, we have certain nursing students that are selected, and we try to keep those within our community, from our community. And they're able to complete their clinicals with us while they're in nursing school, which is huge because by the time they graduate, they are a full functioning nurse. And so it limits that orientation period after they get out of school. So it gives them more confidence. It makes them a stronger nurse. And they're familiar with our area and our hospital. And it also helps with retention with that. And the best part, they get paid while they're doing it. So it's even better. They get to know our nurses. So those are two really good programs that we offer at the hospital that we're very proud of. We also partner with other colleges, nursing schools, and do preceptorships. So if someone did get selected for the apprentice, we also provide the preceptorship where they can come in and they train with our nurses while they're doing their clinicals. So that's also another way that we recruit. I think one of our biggest things is we're trying to create a pipeline within Limestone County to produce our nurses. And we have a lot of nurses that and healthcare workers that are from around this area. Their families come to this hospital, they care about this hospital, and they want to work here. And because they're taking care of their family, right? They want to see the future of it. So we've got some really good things going on at the hospital. Thank you.
Anthony, let's move over to you. So, what steps is the hospital taking to expand or modernize surgical services in a smaller facility setting? And what role does robotic surgery or other advancements play in the hospital's future?
Expanding and modernizing is crucial to positive patient outcomes. So there's three things that we're doing continually. We're assessing, we're evaluating, and we're investing. We assess what we're doing, what we're capable of doing. Then we also assess the community needs to identify gaps in the services that we provide. And then we try to marry those two things together and we evaluate our current infrastructure. What do we have that we can use to add new services? What would it take to increase those or add to those service lines to meet those community needs? And then lastly, we invest in upgraded facilities and equipment and technology. And that's also in providers, bringing new providers to the area. Some specific outcomes that we've been able to attain the last several years doing this process. In 2017, we opened the surgery tower on the east side of town. We added 4 ORs there, bringing our total number of ORs in the hospital to 10 at the hospital and tower combined. As Traci mentioned, we're averaging over 1,000 cases per month now. We had nearly 12,000 last year, just doing what we can to meet that growth. We regularly update things like our surgical video, our power tools for orthopedic surgery, those kinds of technologies that are something new every day is coming out. So we want to stay on the leading edge of technology. So we set up lease agreements where every 5 years we're able to replace those things. We're currently in the process of planning stages for adding additional ORs at the hospital. We hope to have that done within the next couple of years. As we increase our space at the hospital, have newer, larger rooms, we'll be able to bring on a robot you mentioned. robots are commonplace in smaller hospitals now. That's something we're not able to do with the space we have. So with the new rooms that we anticipate getting, we want to add that capability for urology, general surgery, and women's health general surgery. We do currently have 2 robots for orthopedic surgeries. We have one at the tower, one at the hospital that assist in joint replacements. We've had those a couple years now, I think, but that's brought more surgery capabilities here in Limestone County that, you can stay here at your hometown hospital and not have to go to a bigger place.
Thank you. Dr. Walker, heart disease remains the leading cause of death in the U.S. What are the biggest barriers to prevention in rural and community settings?
Well, there are several things. So first of all, I just want to say thank you for inviting me. As a representative of the physician staff, I'm a cardiologist. So when patients come to see me, they've already got disease a lot of times. So prevention really begins before they come to my office. And in community settings, and especially in Limestone County, there are several things that contribute to preventing people from being healthy and developing heart disease. Heart disease is prevented by healthy diet, regular exercise, not smoking, seeing your doctor regularly, getting preventative screenings early. And I think that our community in particular has actually done a really good job, and I think they're still working on increasing access to community clinics where they can get early screening, get regular screenings, even in pediatrics, because again, childhood obesity is on the rise, childhood diabetes is on the rise, and we really want to prevent those comorbidities, those problems that lead to heart disease early. The community also has done a great job of increasing spaces for exercise, and I hope to see that expands into the county more, because I get a lot of patients who live out in the county and they don't feel like they can walk down their county roads. There's no sidewalks, and they don't have a really close pace to exercise. My patients who live in the city are able to use the rec center, which is fantastic. There's a place for them to walk, a place for them to exercise. There's a fantastic set of trails near there as well, where people can walk, exercise, bike. And I really think that stressing that healthy lifestyle is important. And in our community, it's really tough because people are super busy. So trying to fit in, fixing healthy meals, getting regular exercise when a lot of families, both parents are working, everybody's super busy with activities. And a lot of times the healthy parts get left behind. So I think stressing it, not just in Limestone County, but just, in the U.S. in general, putting a focus of work-life balance and focusing on prevention early is the key.
Thank you. Bret, the emergency department often serves as the front door of a hospital. What are you seeing in patient volumes and acuity, and what strategies are in place to reduce these wait times?
Well, you heard Traci speak to the number of patients we see per year, about 30,000. And so as our community grows, our number of patients that we see grows. The acuity, we are seeing a lot sicker patients, and a lot of that student patients just living longer. So that's a balance on what we are able to do in that emergency department. We have 17 beds. One of the things we do is we have something called triage protocols, and that's where when patients come in, within 3 to 5 minutes, they're assessed and they're put in a category, and then we can actually order labs, x-rays. We can start the process of what used to happen in the back when you were already on a bed. We do that out front in the lobby, and so you're still diminishing your wait time by having those things. So by the time you get to the back and in a bed with a physician, he already has or she already has all the results to start working you up and figuring out what's wrong and kind of coming up with a treatment plan for you. So that's one of the things we're doing. One of the other things is we're looking at trying to expand and figure out ways to come up with seated treatment areas. And that'll be an area where when a person comes to the emergency department and maybe they don't have an acute process going on, but they do have, and they're sick, but they've chosen the emergency department instead of an urgent care, then we've got to find a place to put them. So not to tie up the acuity in the back with those beds, but try to still figure out a way to treat those patients and help them along. So the seated treatment areas are a way that we're going to be able to provide that. The other thing that we try to do is engage the community with activities like this. And, Susan, your healthy conversations. And so healthy conversations is something you all can do. You can go to the podcast and you can actually watch our ER director explain the difference in when to use an urgent care versus the emergency department. So community education goes a long way in helping us balance those numbers of which patients we treat. We treat everybody, but sometimes the patients with lower acuity have to wait a little longer while we're taking care of the really sick patients.
Traci, from an administrative and strategic standpoint, what are the top priorities for the hospital in the next 3 to 5 years, ways that we also are looking at keeping patients local?
So we just finished our strategic planning cycle. We do this every 3 years. And so we just wrapped up 25 through 27. And we started it back in February of 24. And this was, we involved all stakeholders, board, medical staff, senior leadership, department directors, our patient family advisory council. We did SWOT analyses with all these people and said, hey, what are our strengths? What are our weaknesses? What are the threats? What are the opportunities that we have in the next 3 to 5 years? And we always have that caveat in the back of our minds. Well, we may have to switch gears really quick, and this may go out the door like it did in 2020, because, you know, during that time, and everybody always talks about, I say BC, before COVID, we learned real quick that, you know, you have to be adaptable. But with strategic planning, we look at what we can do to improve things and where we are and where we want to be. But we know that our priorities are clear. We want to grow services so that care stays local. We want to invest in people and technology. As Anthony mentioned, we have a booming surgery department, and we want to continue to expound on that. And we want to ensure that our hospital remains the trusted place for generations to come. Next year, we celebrate 75 years in Limestone County, and hope to hear more about that later in the coming months. But some of the things that I want to mention as priority is to maintain and improve our facilities. It's an aging facility, looking at the expansion of the 30 beds, expansion of the OR, expanding of the ER as well, looking at a new nuclear medicine camera in the next few weeks, hopefully. Another important thing is to control expenses and develop and grow service lines, endocrinology, continue to build urology, and orthopedics. They have a new provider that I think starts this month, Shay. So we're excited to welcome Dr. Murphy as well. And then, but at the base of all is to continue to provide high quality care. Looking at our star ratings, looking at hospital compare, what are the things that we don't do well that we need to improve, and doing performance improvement projects to continue to just make it the best quality health care for people local.
So, Catherine, let's go back to you about our staffing. Let's see. How is the hospital supporting nurse retention in a competitive market, and what initiatives are in place to support nurse well-being and prevent burnout?
So retention, it comes down to nurses feeling that they are supported and they're heard and they've got room to grow. And one of the ideas that or initiatives that we have for this year is introducing our clinical ladder to our staff, which is a leveling process for the nurses. And it really gets them involved from the ground up ideas. It may be decision makings for policies. It could be educational opportunities where they teach their peers. And they get rewarded for that. And so I think a lot of times nurses feel like their voices aren't heard. So I do believe that the clinical ladder is going to help with that and really get them involved. Another way that we like to recognize our staff, we do a really good job on social media, so kudos to Susan and the team for that. But one of the awards that we give out quarterly is our Daisy Award for our nurses. And that is where we have a nurse that is nominated either by a patient, family, or peers for a job well done. And it's not just one nurse, it's multiple nurses. And that has really grown. And so we vote on that as a committee, and quarterly that is given out to one nurse. And it is one of the highest honors that a nurse can receive. But not just that nurse, but we also recognize those nurses that got nominated for it as well, so that they know that their name was put in that pot. We do peer recognition, so it doesn't have to be just a nurse. It could be any healthcare worker that does a great job and they get nominated by a family or a peer. and we're able to recognize them on social media and give them a gift. So a lot of times just being recognized for the job well done that we want to make sure that people know that they're doing a great job out there. So recognition there does help with the retention. To help with well-being, we do have our employee assistance program, and we utilize that, and anyone can utilize it within our healthcare facility. But a lot of times we do utilize that after we've had difficult situations that have arisen in the hospital, and staff just need to talk to somebody. So we have counseling that's available, and it doesn't have to be just from a situation. It could be there, something's going on at home, but they have that opportunity to talk with someone at any time. So I'm proud that we have that and can offer that to our staff.
Bret, let's stay on staffing for just a minute and ask you to address the nationwide shortage of paramedics.
Well, a couple of things we're doing. One, we partner with our local colleges that have a training program, and so they're allowed to do clinicals at our hospital, which is kind of an on-the-job application or interview as they work through their training process. So we get to see if they're going to be a good employee, and they get to see if we're going to be a good service that's a good fit for them. We are able, because we're part of the Huntsville Hospital EMS system, we're able to participate in the EMS Academy. The EMS Academy is a training program that actually trains EMTs, advanced EMTs, and paramedics. So they're hired on before they're licensed, and we put them through that academy. So because we're a part of that system now, our employees and the people we hire are able to participate. It functions much like the nurse apprenticeship program. While they're in school, they're doing clinicals, and they're being paid the entire time. So that's a really a big bonus for us that is newly acquired since we've joined the Huntsville Hospital EMS system. One of the other things we do is we try to expand their scope of practice. So if we allow the paramedic to do the things he or she was trained to do, then they're more willing to come to our service. And so we're looking at adding blood products to the ambulance and a critical care endorsement on their license, which allows them to function at a higher level than some of the other local agencies that will directly benefit the community if you're in need of those services. So we're always looking at expanding that scope and providing them with the latest technology, up-to-date equipment. We've got a power load cot. You may not know what that is, but what that means is back in my day when I was a paramedic, I had to bend down and lift the patients up. And in case you didn't hear Dr. Walker, patients are slightly more obese than they used to be. No offense, but they are. Now we put the patients on the stretcher and we push a button and the cot lifts up and loads in the truck. So that kind of technology, paramedics are looking to work for a service that incorporates that kind of technology as opposed to the old manual way of doing things. So we buy new ambulances. We've had a new ambulance for the last 3 years. We've got one coming in the fall of this year, and then we'll have another one coming in the middle of next year. So updating equipment, latest technology, all those are recruiting techniques that we use to try to recruit paramedics to come work in Athens-Limestone ambulance service.
Dr. Walker, how do you work with primary care providers or other providers to ensure coordinated care for patients?
So when patients come into the hospital, we actually start working on discharge plans as soon as they come in. Number one, when patients come to the hospital, they come in for multiple reasons, not only because they're acutely ill, but there could be other things going on that led to their hospitalization, lack of access of care, running out of medications, lack of help at home that's needed. So we look at those needs as soon as they come into the hospital. We have case managers who help us coordinate care, not only with the primary care providers post-discharge, but any specialist follow-ups that are needed, home health needs. We make sure that patients have the medications that they need. With primary care providers in particular, when we do a discharge summary, when somebody is discharged from the hospital, there's a summary of the entire hospital course that is put into the electronic medical record that is then sent to the primary care physician's office. Our orders when a patient is discharged also include what's called follow-up appointments. So our staff in the hospital actually call those offices and make sure that patients have appointments so that they can see their primary care provider quickly after discharge. This helps reduce the risk for rehospitalization, running out of medications, and helps us continue the plan once patients are discharged. Additionally, again, if they need things like home health, that is arranged for them before they go home. If patients need medications, we have a
pharmacy in the hospital that it's called Meds to Beds. I always say that backwards. So the pharmacy will actually bring the patient their medication before they leave the hospital, so we can physically see they have the medicines that they need. And then that quick follow-up is really essential to make sure that those medications are continued or adjusted as needed.
Thank you. Anthony, are there particular procedures or specialties that you see growing in demand in community hospitals like ours?
Yes, currently I see 3 areas of surgery that's really growing right now. That's our general surgery, our orthopedic spine pain management services from one of our supporting sponsors, TOC. Didn't know they were going to be sponsoring when I said that, but it is true. And then we've added, as Traci mentioned, gastroenterology as a new service that we're providing now. So we see a lot of growth in that area. The general surgery group here in Athens recently added a new surgeon. So they are growing. That's general surgeries, your gallbladders, your hernias, colon surgeries, biopsies, and what I like to call lumps, bumps, and lesions. All that's your general surgeons, and they're really growing in their practice. With the ortho spine pain management, both sports medicine and total joints are really growing. You may not know, you can come in and have your hip replaced or knee replaced, and if you meet criteria, you can go home in the same day now. So there's amazing technology out there, and we have really great surgeons providing great care. But that inpatient, outpatient is a big deal, I think, with our joints. And then, like I said, with the addition of a gastroenterology service, we're seeing more patients in that area, not just screening colonoscopy, but treating more serious digestive problems of the patients. Another area that I anticipate seeing growth in is the GYN women's health. We recently added 2 providers to that service line, so I anticipate seeing more patients in surgery from that service line.
So, Traci, how do you see partnerships with our local schools, businesses, and community organizations helping to strengthen healthcare delivery and ensure a healthier future for Limestone County?
Our foundation plays a vital role in our partnerships with local businesses. If you don't know Caroline and Kristen, you probably moved here last week because they're out and about a lot, and they have really taken the hospital to the forefront in our partnerships with local businesses. Catherine mentioned our ALH Ambassador Program. This will be our 4th year, I think, either 3rd or 4th year with these juniors and seniors. And this program warms my heart. And it gives them a look at the day in the life, and they spend their entire junior and senior year at the hospital shadowing me, shadowing Anthony and Bret, nursing, imaging, our medical records department, plan ops. They can look in every area. And it's interesting because the first day they come, I'm like, okay, so what do you want to be? What is your plan in a couple years, And they're like, I'm going to be a cardiothoracic pediatric surgeon. I'm like, okay. Yeah, that was your son. And then by the end of their rotation, they're like, I'm going to be a nurse. And then that really warms my heart because I'm a nurse. So it kind of it kind of changes their trajectory, and it kind of changes sometimes their career path. So that has been a great program for us. And one of my favorite things is the Partners in Education. A few years ago, I went to an event, and I was like, well, who's our partner in education? Because I just felt like we needed to up our game a little bit. And so we partner with Julia Newman, and every hospital department adopts a classroom at Julia Newman. And we take them goodies and snacks, and we give the teachers breaks, and we do gifts for Christmas and pumpkins for Halloween, and it makes us happy to go see those kids. And I think it's important to plant the seed as early as possible. Somebody in pre-K may say, I remember that nurse that came and brought me a pumpkin at Halloween, and realize that a hospital's not a bad place. It's a place where we help people, and hopefully we can jumpstart that in their little minds early on. And then, of course, recruiting new providers to the area is important in growing in our community as well. And one of the first things they look at is our school system, So, and then they also want to talk about the downtown area. And so we're blessed to be in a thriving community and have great partnerships.
Bret, what does the collaboration between dispatch, EMS, and the ER look like, and how does that benefit patients in an urgent or life-threatening situation?
Well, first I want to talk about dispatch. For 50 years, this hospital had a dispatch room, and I do mean just a room, where we deployed ambulances across this county when you guys called 911. It was a very antiquated old system. And just recently, about 8 weeks ago, Brandon Wallace is sitting back in the corner there, and I got together and we co-located our dispatch in the 911 center, which is where it belongs. We're the first agency in Limestone County to do that, and we're 8 weeks in, and I promise you, we've probably shaved a minute to a minute and a half off each ambulance call. What that means is when you dial 911 and need an ambulance, about a minute to a minute and a half quicker, that ambulance is dispatched and responds to your need. So we just see this as, it's incredible what has happened so far with that. So we're getting the emergency care you need to you faster by using our technology and partnerships with the 911 center. We appreciate that. EMS and ER, I've got one quick story, I promise it's quick, to tell you about. The ER, the hospital is looking at taking care of stroke patients better. We're just going to do a better job when you walk in the door of identifying and implementing certain actions that happen when you come in with stroke symptoms. Well, by seeing that in the emergency department, the ambulance service, we got involved and said, hey, this can happen at someone's home. So what we did, as the hospital is developing the stroke protocol and redefining that and making that better and more efficient, we looked at the same thing with the emergency or with the ambulance service. So now the paramedics are doing the same, using the same type triage principles that the RN and the doctors are using in the hospital in the pre-hospital setting. We notify the ER by radio, and then the patient is gone straight to CT quicker than what we used to do. So that partnership with EMS and the ER has revamped the way we're going to take care of stroke patients going forward. I mentioned communication. We recently upgraded our radio system to the P25 system. That's fancy for just a digital mode of communication. What it lets us do is communicate with the city, with the county, with fire departments. So everybody in our county uses the P25, and now the ambulance service is able to communicate. So when we have an event, such as a tornado or a major car accident, train derailment, any of those things, and we're able to communicate each agency, and it makes the event just go a lot smoother, a lot more efficient, and you guys will receive the help you need in the event of those kind of things that happen. So, yeah.
Thank you. Catherine, how do you foster leadership development among bedside nurses to prepare them for future management roles?
You heard me earlier talk about the clinical ladder. That was just one way that we do recognize and reward expertise and leadership. Another program that we implemented a year ago is the B Leadership Development Program, which stands for Building Excellent Executives. And this is a selected number of our emerging leaders within the hospital that are able to do a year program where they are involved in community events, projects, and also they shadow within the hospital in different areas. So it's not just a nursing area. It could be anywhere. It could be with Randy in finance or Mark. But it gives them an opportunity to learn more about the hospital. So as they grow in their leadership roles, they're able to understand the complexity and how the hospital functions. So that's been a great thing the past year, and we actually had 12 emerging leaders complete this program. So we're excited for the next round to come through. Another way that we help promote leadership is tuition support. So if we have a nurse who has an ADN and wants to go on to get their BSN, we do help provide that tuition support. Also for specialty certifications, it could be a nurse who wants to advance and be a wound nurse and wants to take that wound certification, and we help pay for that. So those are just some ways that we help with the leadership piece to that.
And Anthony, how are we ensuring surgical care remains high quality, safe, and patient focused in a rural or a community setting?
Well, Traci and I both mentioned earlier about our volumes being the busiest OR outside the Madison County area. But even with that said, safety is our top priority. Surgical site infections remain some of the lowest in the state, and that's all due to ongoing education for our nurses. We offer national certifications for our scrub techs and our central sterile techs. Being a part of the Huntsville health system, we're able to network with sister hospitals and talk to our counterparts at other places to see what they're doing just to maintain and be at the top of our game. I think it was Traci that mentioned earlier, teamwork in a smaller hospital. We're able to meet one-on-one with our coworkers, or make phone calls if we need something. don't have to go through a big, long process. So doing things like that, you can do that in a smaller facility that you can't do in a larger facility, and just promote safety and positive patient outcomes.
Dr. Walker, how is the physician-patient communication evolving, especially in today's fast-paced, technology-driven environment?
So it definitely has changed over the last few years. As you guys know, we've moved from paper charts. We used to write notes, orders, everything on paper. We've moved to an electronic system called the EMR, Electronic Medical Records. There's usually a system in the office and a system at the hospital that's used for keeping records. And it's also a way for us to communicate with patients. So if you're going to your primary's office or if you're coming to the hospital for a test or a procedure, you usually are asked if you would like your portal link. And it's really important to say yes to that and to sign up for a portal, because what that does is it allows you to not only communicate with your provider, with the provider, like your physician's nurse, it also allows you to get access to your records, your test results very quickly, which is terrific for patients. It allows patients to know kind of up to date what's going on with them. And it allows us, again, to communicate with them effectively and more quickly than traditionally answering phones, getting messages back and forth. We're also using texting more right now for things like getting appointments, confirming appointments, changing appointments. Our system, the Heart Center in particular, is actually starting a HIPAA-compliant text message system with patients, where you can actually get results of your testing or speak to the my nurse about a question that you have, rather than trying to get through phone trees and messages and callbacks. What it'll do is it'll actually send you a message and it'll say, "Are you okay if we proceed with the conversation?" So that it is HIPAA compliant and that you feel your data is secure, and the nurse can text you and say, "Hey, your tests look great." Or, "Hey, we want to do a follow-up with you." And it really expedites that communication.
Thank you. Well, we're going to close with 2 questions. And the first one, we'll go back to Dr. Walker and just ask, what gives you hope or concern about the future of practicing medicine in a community hospital setting? And how can the community partner with the health system to create better outcomes for all?
Well, I definitely have a lot of hope of practicing in a community setting. I grew up in Limestone County. I went to West Limestone, came back here to practice, and don't have any plans on leaving. I love our community. I love the growth of our hospital system, and it gives me great hope of seeing this community continuing to grow and to thrive. I love the word partner. Because that's really what we need from our community. Is we need a partner in healthcare to move forward and to continue to improve our healthcare for our entire community. One of the ways we do that is we get a lot of community involvement to the hospital through our foundation board, our hospital board. We have an advisory committee, a patient family advisory committee. We also have volunteer opportunities at the hospital. So we love community input. We want you to be involved with the hospital in what we're doing. We have lots of opportunities for volunteerism, for helping fundraise for things that we need for the hospital. And it's really important to have that partnership with you all. I think also as a community, as we continue to grow, as our community grows, our population grows, having more spaces for patients to stay healthy. So again, those walking trails, the rec center, those are so vital to our health of our community. I know there's a food city coming, I think, on the outskirts of West Limestone. That is huge for people who live in the West Limestone area. I mean, again, I grew up in the county, and it was 20, 30-minute drive to get to the nearest grocery store. And that's a big deal for patients, especially with the economy. So getting more access to healthy foods, healthcare, having those community clinics out in the outreaches is so vital for our patients to stay healthy. And we really, really appreciate all you that are out here, Mr. Marks, Tony, all of our board members, people that are already involved in helping us make Limestone County healthier. Really appreciate that.
All right, Traci, let's let you close us out. What excites you most about the future of healthcare in our region?
I think we've already touched on it several times about our growing community. It's not growing, but it's thriving. So much so, people want to move here. We have providers that reach out to us that like, we heard about you, what's going on there, and we do a really good job of recruiting those physicians that want to come here. But like I said, we're not having to reach out to them; they're reaching out to us. So that excites me. It excites me that people want to come here. And our affiliation with the Huntsville Hospital Health System, we have a large network of support. I'm supported by Jeff Sams as the CEO of the system. We meet every week as a group, and we talk about patient safety and what we can do better to improve and how we can improve and how we can learn from one another. And we do that in different departments as well, not just in the senior leadership. But it's also important, I think, that we continue to build a strong culture in our hospital. People often comment when they come here is they can feel, and it's palpable, how our culture is at the hospital and how it's a family atmosphere. And that's how we feel. It's family taking care of family. And we're going to treat you like we're going to treat our mom and our dad. And I think it's evident for everybody that walks through those doors. That excites me. The future of healthcare excites me, even though there's been challenging times. I feel like we have kind of bound together and overcome a lot of challenges. But I'm excited and grateful for this opportunity. And our mission statement is to be the difference. If you haven't heard that, you probably haven't been around any of us very long. But that's what we want to do, is we want to be the difference when it comes to health care. And we want to continue to make Limestone County proud by being a top-tier hospital in our country.
Thank you to our panelists for your honesty, your expertise, and your heart for the community. And on behalf of the hospital, thank you to everyone here, our chamber, civic leaders, healthcare partners, first responders, and citizens for being part of the solution. So as Pammy comes, let's continue the conversation and keep working together to be the difference.
Thank you. Let's give Susan a round of applause. Great job, Susan. Great job. All righty, so we've got like a couple more minutes. Does anyone have any questions that they would like to ask any of the panelists? Yes.
Justin Dine, just a question about Dr. Walker. You mentioned specifically the preventive side of the house, which big state, let's be clear, it's a big state. And to couple that with some of the stuff that goes on with the city and the county with food funds plus, food funds and food as an example, at April 2023. How do you feel as a physician your relationship is with the county and with the city and all the local leaders and actually getting the word out? This is what we have to do actually as a community to make our members, our citizens healthier. Do you feel like there's a forum for you to communicate, hey, we really need more sidewalks, like you mentioned? Like, what is the next step after you saying need more sidewalks to talking with the council or talking to the county commission about actually getting that done? I've only been here a year, and it's hard, even as a citizen, to get ears at the county or at the city level. Pretty much just ignore it. It's got a lot going on. So the position, your side of the house, how do you get your voice heard? How do we as citizens actually get more of the things we bring up? Thank you.
Yeah, thank you. I haven't been to any board meetings, or council meetings, but I think that's a great idea, going forward. I certainly have noticed, in talking to patients recently, more, patients are living further out in the county. And it is hard for them to find places to exercise and walk safely. And that's something that, I'm happy to talk to, I guess it would be the county commission, about, ways that we can make healthy green spaces for patients, not just in the city, but in the county as well. Because I really do feel like it's really important, for the future of the growth of this community. Is astounding how much this place has grown. And you said you've been here for a year. I've been here for well over 30 years. I moved here when I was 11, and this city and the county looks completely different. It is a completely, just a different city, a different feel. And I feel like with the traction, with more population coming in, there's more need for those green spaces. There's more need to provide those settings for patients and for our community.
Thank you so much. Thank you. All righty, you all. I like to extend another special thank you to our panelists, Traci Collins, Bret McGill, Anthony Blackwood, Catherine Brown, and Dr. Crystal Walker, for sharing your knowledge, your experiences, your vision, your future, your leadership and dedication. Remind us that healthcare is not just about treating illness, but it's about building a healthier, stronger community for all of us. Together, we can ensure that Athens-Limestone County remains a place where healthcare is strong, accessible, and forward-thinking. We appreciate your time and commitment, and we look forward to seeing you all at our future chamber events. Safe travels, and have a wonderful day. And before I'm dismissed, I've just got to piggyback on something that Traci said. And it's just a little testimony. I was seeing my doctor. I found out I have sleep apnea. And I had to go through a lot of testing. And so the technician came back, she came up front to get me. And as I walked through the halls to the testing area, of course, speaking to everyone that I saw, and people were like, "Hi, Pammy." And the technician looked at me, she said, "Oh my God, you know everybody in this hospital." So it goes back to you all, our family. You get to know the community, and we're just so fortunate, you all, to have a healthcare system in our community that cares for us. So thank you. Kudos to all of you all for what you do. And you all, let's support our hospital. Thank you and have a great day.